I had a question about the healthcare issue, because I'm a single-payer supporter. And my problem with the whole concept of capitalism and healthcare is that people have no control of when they become sick, and so you can't really shop around. I mean, if we eliminated the insurance companies, for instance, and you were going to do a pay-for-services thing, what I think single-payer does is that everybody pays taxes, and they get equal access, equal care. So with the system of single payer, it just seems like with capitalism, it just doesn't work to me. I don't understand how capitalism can really work with healthcare, because people they go, oh, I'm going to get cancer in 20 years, so I better start shopping around now for the best coverage for that.
Okay.
So, yeah, thank you.
Well, first of all, universal coverage is not the same thing as universal care, and we have to be, and medical coverage is not the same thing as medical care, and that's something we really have to make sure that we keep that distinction, because you can guarantee access to everyone and then have everyone waiting in lines for years before they can actually get care. So that's something we need to keep in mind as we go forward and try to figure this mess out. And what I referred to before is like the $20 plan. No, that doesn't exist right now because it's illegal. Like in Washington State, you can't. The plan I would personally like to have is a $10,000 deductible, an HSA, and my catastrophic plan for $20. It's illegal in Washington State. The legislators here won't allow me to have that, probably because, like I said before, they get all these kickbacks from all these different industries, and then they say, well, that has to be in the plan, that has to be in the plan, that has to be in the plan, that has to be in the plan. You can't have a catastrophic plan and it costs $20 a month. We can also have pools for people with pre-existing conditions to allow them to get together. We can have pools for small business owners, people that insure themselves, things like that. But one of the reasons the single-payer system for me is unattractive is because, again, to me it infringes upon my individual rights to choose my health care. I don't want a single-payer, and if a single-payer system exists, I'm forced onto that plan. I am forced to have a plan that 435, right, 432 people, whatever they are in Congress, and then the 100 senators, what they decide for that particular moment in time is the adequate plan for me, or that your state legislature decides.
Well, what I always envisioned when I started in my involvement in single payer, what I envisioned was that everyone would pay into the tax system like they pay for Medicare or Social Security, and that you could just go to the doctor. Yes. And you wouldn't get charged anything, just like in England and Canada. And the stress level of the American people when it comes to healthcare is ridiculous. I mean, you should be able to just walk into a hospital and get treatment.
Well, you can actually. That was an act that was passed. You can walk into an emergency room and get treatment.
But basically what I'm saying is that there's no
We're gonna move on.
Yeah, you just kind of